Thank you for joining us tonight for the Healthy Aging, Healthy Voice Talk with Dr. Nicole Maronian and Tracy Newman, speech language pathologist. Before we get started tonight, we'd like to go over some of the housekeeping details. First of all, thank you for taking the time tonight to be part of our virtual talk series and still get education as we're still being socially distanced. For tonight's talk, the presenters will do their presentation and then you can answer questions. To do so, please open the Q&A button that's at the bottom of your screen and you can type your questions in there for our presenters. If you so choose, you may select the anonymous button so your name is not shown. And also to let you know that this webinar is being recorded. Everyone who registered for the event tonight will receive an email with a link to the video to go watch it online. You can share that with your friends and family as well. So without further ado, we'd like to welcome Dr. Nicole Maronian and Tracy Newman.
Thank you. It's really wonderful to be with all of you tonight. My name is Nicole Maronian, and I'm the chair of ear, nose, and throat surgery at University Hospitals. I wanted to share a little bit about me, and then I'll introduce Tracy. I have been with University Hospitals for 15 years, and when I came, Tracy and I started the Voice and Swallowing Center, and we've worked together ever since. I'm fortunate that I am able to specialize in an area around the voice box, or the larynx as we call it, and that's allows us to treat all sorts of conditions associated with the voice, the airway, and swallowing. And so for tonight, we're going to obviously concentrate on the voice and the impacts of aging on the voice. So I wanted to take a moment and ask Tracy to also introduce herself.
Hi, my name is Tracy Newman. I'm a speech language pathologist and I specialize in voice disorders. I've been with University Hospital for about 25 years, but lucky enough to be in the Voice Center with Dr. Maronian for the last 15, where I have been able to specialize in voice disorders and airway and swallowing disorders. There's lots of speech pathologists in the community, and we often specialize in different areas, and this is my specialty, and I've learned to love it over the years and couldn't picture myself doing anything else. I'm so happy to be here today.
Thank you. Well, we are both, Tracy and I, very passionate about this topic, and we're so excited to share it with you and to see what questions and thoughts you might have. So tonight, what we're going to do is talk a little bit about why the voice matters as we age, what is different, and why it can be such a problem. We're going to talk about the function of the vocal cords, how they work, how we make sound. We'll talk about what actually changes for the vocal cords with aging, what problems can occur, and what treatments are available. So for the person who coined that phrase, that the eyes are the window to the soul, we think that they were wrong. If anything can offer us a unique insight into someone's soul, it's the human voice. And so if you look at these pictures, you can automatically hear that child screaming into that older microphone. You can hear the tone of the voice of the woman that's not very happy with her boss right now. And for all of us that have been on so many Zooms and tied to headsets and things like that, you can see, I think, some frustration, and you can anticipate what that voice might sound like just by looking at these pictures. So we really think that the human voice is the window to the soul. Sometimes it can be very subtle. Sometimes that voice can really cry out to you. But the voice is really a very clear example of how the mind and the body are connected. Our tone and the vocal texture changes when we're in love, when we're angry, when we feel insecure, when we're sick. All of that is very noted just from those first few words that a person might say. We can change the meaning of words simply by changing our tone. And when our body language and the words that we speak and our tone don't match, we're often not taken seriously. So by listening to someone's voice, Tracy and I can diagnose health problems. We can hear a croaky voice that might indicate reflux. We can hear a head cold voice that might point to infection or sinusitis. And we hear when the voice is hoarse, which might be a sign of something very worrisome like a cancer. But for tonight's purposes, it might simply be part of what we consider the normal aging process. The voice reveals a lot about us, and that's why it's so important that the voice function for what we need it to do. So why does it matter? Well, our population is not just living longer, it's living healthier, it's much more active, and it's much, much more social. Despite the impacts of this last year, we are indeed more social with aging, and many are more likely to remain employed than any generations before. Some even work their entire career, retire, and then take on an encore career, a whole new career after retirement. We all know these graphs, our population is growing rapidly and living longer. And just in this time span around 2020, so many baby boomers are turning 65 that there's really an exponential growth of those that are aging, living longer, and wanting to live well. I found this CNBC poll interesting. So this shows that there are many US workers that we expect to retire after 65 that don't retire. And so even in this area that I've highlighted, so after 65, 40% are still working, 41% full-time, 38% part-time. And even looking at that group that is 65 and older, only 10% were working in 1985. That's doubled by 2019, and we anticipate will be even larger by 2024. And so those considerations of those encore careers and continuing to work is really important, and we need our voice to be effective, to be believable, and to be able to just not think about it, do whatever we want to do. We've all been impacted by this pandemic. A lot of it has been negative in the news, and certainly there are components of the pandemic that have been problematic. It has accelerated certain problems. Wearing masks and trying to talk is really hard. It's hard for people that have hearing loss. It's hard for us that are wearing masks a lot at work because we really have to push our voice. It's increased the amount of hoarseness that we see in patients because everyone's trying to speak louder. Everyone's trying to be heard through all these extra layers. Some components of the pandemic, though, have been positive because people now can see that they can also function at home through Zoom and potentially work in virtual careers. That opened up opportunities for many people that thought that they just didn't want to go back to the office 9 to 5, but now they have new opportunities in this post-pandemic world. Some want to work, some have to work. And that might be because there weren't opportunities to save enough. For some, investments were hit very hard in financial crises. For some, the sandwich generation in particular, if they're utilizing all their funds, not only for their own family, but to care for aging parents, to help adult children, it can be very difficult to consider how we're ever going to stop working. Pensions are not universal. And so for some, and having not been able to put enough into 401ks, there's also the need sometimes to continue to work. And we constantly hear in the news about threats to Social Security. And so with that concern, many are choosing to work longer to allay those fears and to assure that they have opportunities to be comfortable when they do finally decide to retire. And so with all these pressures to potentially continue to work, what we hear and what we hear in our patients and what we want to assure doesn't happen is we want to avoid any form of voice discrimination, so that just by hearing the tone of the voice, people may have concerns about whether or not someone can do this job that they might be applying for. Unfortunately, it's not just 65 and older. So we start to notice these problems a little earlier. So for some, at 55 and older, there can be some changes that start to occur. And it's important that we identify it early, not wait too long, because it can certainly hamper and impact all those years leading into an actual retirement. And so productivity can be impacted. And the things that we talked about earlier, that enjoyment of work, the enjoyment of family, the enjoyment of social gatherings, if people are starting to, in these younger years, pull themselves back from going out to the restaurant because, boy, everyone complains they can't hear me. Or if they're not going to go to that party because I just get tired using my voice, those are the things that we feel very strongly about that need treatment. So we've talked a lot about aging and the voice, but what is it? So we call it a special term called presbyphonia. And presbyphonia simply means age-related changes to the voice. These changes are not particularly dangerous. They're just different, but it's a very discrete set of voice changes. The vocal cords are muscles, just like your legs, just like your arms. And I know I am constantly humbled when I try to exercise with my kids and I find I can't do what I used to do. And the vocal cords are no different. So the voice may get a little softer, a little rougher, or a little bit more effortful or strained. And that might sound kind of like this. And many people don't like that sound. It doesn't sound like them. And this can come on really slowly in a very subtle way. And for some, what we hear in the office is, I don't really notice it, but others are hearing it. They tell me that I don't sound right, or they're constantly asking me, are you sick? And those are the kinds of things, particularly when we have that slow, subtle onset, that we think about and relate to this diagnosis of presbyphonia. So why treat it? Well, it's not life-threatening, we've said that, but what studies have shown is that if presbyphonia is not treated, it likely will not get better, and it may even get worse. And so if we go back to that whole theme that we have, Tracy and I feel really strongly, this voice, your voice matters. The voice matters for social interaction, to avoid withdrawal, social isolation, and depression. We've all suffered some forms of that this year, and we certainly don't want just the voice to cause that cascade that pulls us away from family and friends and allows us to maintain that active involvement in the workforce should we choose to do so. So I'm going to share with you a patient example. This patient is 58 years old, and she noted 6 months of progressive hoarseness. And by that, she meant it started very without warning. It was very subtle. And all she noted that most of the time the voice was a little softer, sometimes a little raspier. And she really noticed that it was very tiring to use the voice. She would use it at work and she would do pretty well in the morning, but then sometimes by early afternoon, it was just hard to make the voice come out in a smooth way. She was feeling like the throat was really tight, and she just tried to avoid getting on some of the afternoon meetings that she was obligated to do. By the end of the day, she was wiped out. She was exhausted. She didn't want to go out socially because the thought of trying to raise her voice over a crowd or in a restaurant was simply too tiring. So ultimately, she came and saw us at the Voice and Swallowing Center with these concerns. She did say, this isn't a big deal. It's not preventing me from doing anything. It's just an annoyance and it bothers me and I want to know why. And so we were able to do a scope in the office, which many of us will do in ENT offices. And this showed us her vocal cords, which are these white bands right here. And it showed us the space in the middle. And this is what we call presbyphonia. So let's talk a little bit about the function of those vocal cords. So the vocal cords or vocal folds are muscles. As we talked about just a few moments ago, they're just like any other muscle in the body. They're housed within the voice box, which is if you feel your Adam's apple, the voice box is that cartilaginous structure right here in the center of your throat. The vocal cords sit right in the midline. They normally open all the way when we breathe. They close all the way when we speak and when we swallow. When we speak, we hold those vocal cords together and we let the air come out of our lungs, which is how we produce sound. Those vocal cords are unique though, because unlike our arms or our fingers, they actually have a vibratory component. So like my arm with this outer sleeve, this component vibrates. And when it vibrates, it allows us to have that wonderful tone and inflection in our voice. It allows us to get higher. It allows us to get lower. And they're really beautiful muscles, and it's a pleasure to see them when they're working and functioning well. The biggest requirement for speech, aside from healthy vocal cords, are healthy lungs. And so the requirements for speech are that we're able to take a big breath, fill our lungs, we're able to pass the air up through the trachea or the windpipe, which is where it passes through those vocal folds. So the vocal folds sit right here in the middle of the neck. That air from the lungs passes up through there and then back out through the mouth, which is what we hear as the voice we recognize. All of the surfaces in the mouth help us to shape the words for articulation and for the resonance. Now, Tracy can tell you a lot about this, but bottom line is that all of our articulation is fashioned by every single surface in the mouth, and it's very critical that all of those function well as we age. I'm going to go back to that respiratory passage again because the lungs are critical. They're the power, they're the battery, they're the generator, they're where things start. We have to take deep breaths in, and most of the time when we're talking, we don't have to think about our breath. But at times when we're dealing with a voice disorder, it's exactly the thing that we concentrate on. So we can take deep breaths in through our nose, we can take deep breaths in through our mouth. It doesn't matter. Usually we're using both and we don't even think about it to fill up our lungs. At the end of that big inhale is when we start to exhale, letting the sound out, which gives us the ability to push the voice out along with it. So if we go back to those vocal cords, what are some of the things that we see that we consider that age-related change, that presbyphonia? Since they're muscles, those muscles get thinner with age. It's an unfortunate truth. I don't like it either, but that's what we see everywhere in our body, and the vocal cords are no different. They also become less flexible. They have a harder time, a less resilience in terms of coming back from any injuries, and certainly are not very tolerant of situations where particularly the lungs are a little bit weaker. All of the linings of the nose, the mouth, the vocal cords, and the lungs all need moisture. And if that moisture is lacking, it also affects the quality that we hear in the voice. So dry mouth, which affects so many of us, can significantly impact the linings lower down in the throat, can cause the vocal cords to not function optimally, and can also cause them to lose some of that elasticity, the things that make that nice wave pattern happen. So what does normal look like? Well, we showed you those vocal cords earlier. Here's those vocal cords again, and I'm going to just spend a little bit more time. The vocal cords are here. They're these long bands. They're very fine, thin muscles. This is the front of the voice box, the part that you can feel from your neck. This is the back of the voice box. This is the right vocal cord. This is the left vocal cord. And this is a beautiful view down into that windpipe or the trachea. And this is a normal appearance of the vocal cords. And you see nice, shiny little white spots. Those aren't lesions. That's normal mucus and normal moisture that's on the membranes. And this is a great normal looking larynx. When we look over here, the person has taken a nice breath, and now they're closing their vocal cords, and they close them all the way to create sound. And this is what we call complete closure. So if we think about this complete closure, what we see with presbyphonia is this gap, this bowing. So these vocal cords are not quite coming all the way together. And when we have this space, what we have to do is compensate. And so what we do is we start to squeeze all the other muscles, these false vocal cords around together, including the muscles on the outside of the neck, to try to bring the voice out. Essentially, when we have a gap like this, we leak a little bit of air. We don't have the control that we had when we could close those vocal cords almost all the way. And with that little leak, we end up getting an unstable voice, an uneven voice, or a voice that just fades. And then if you think about using all those extra muscles, it's tiring. And that's where that component of irregular tone, raspy, and then also the fatigue comes from. So I think if you just think about these two pictures, the normal compared to that little gap, it starts to make sense why that little bit of thinning, that little space has such big impact down the road. So we think about treatment for this problem. I'm encouraging us to think about treatment for this problem, because when you have these issues, that raspy quality, that reduced volume, decreased projection, that really reduced endurance and easy fatigability, it really becomes challenging to do the things you want to do. Sometimes we also have heard concerns with patients that will say, I feel like I'm constantly out of breath when I'm trying to talk. And that's also one of those components that we associate with that little leak. Some people find that there's tremors or shakiness from speech, even related to how hard they have to work to close those vocal cords. For men, sometimes that pitch can go up and change as they age, and that's not really comfortable. They usually like their deeper, more resonant voice. For women, sometimes the pitch can go down, and if it goes down and gets raspy, that's not very comfortable for many women. And often they feel like I sound like a man, I don't sound like me, or people again are asking me if I'm ill. Now, there's always other factors that can affect the vocal cords, regardless of age. And they can also be layered on top of just that vocal cord thinning that we're talking about. Reflux, heartburn, and digestion, it's very common. And because we have that food tube right next to the voice box, those issues can affect the vocal cords and also cause some voice changes. I've focused a lot on the breath. So breathing issues can absolutely impact the voice. So if we think about things like smoking, COPD, asthma, those all will impact our ability to generate the big breath that gives us that nice clarity and ability to project our voice. If I even think about COVID right now and all of the some of the deconditioning that happened because we weren't getting out, we weren't doing our normal routines, just deconditioning and trying to get back into a routine can have effect on that voice, because we don't have the lung strength that we did. Overuse and abuse. So if we're talking too loudly, if we're clearing our throat a lot, coughing a lot, all of those things also impact the vocal cords, can affect the voice, can worsen that presbyphonia. Hearing changes. This is something that's also quite subtle. So for many of us that are affected by hearing change, it impacts the way we hear our own voice. And so sometimes it can be hard for us to hear voice changes. Sometimes we adjust our voice because it becomes easier for us to hear ourselves. And so those are also factors that we work on when we're thinking about a holistic view related to fixing any kind of voice problems that come in to see us. So what does treatment look like? Well, it typically starts with an office visit. Sometimes first with a primary care physician, but most of the time with an ENT, and sometimes with a voice specialist like myself and Tracy. We'll typically take a history, we'll do a thorough exam, we'll look in the throat, but it's very hard to see the vocal cords by just looking in the throat. We have to go around the corner. And so the way that we can do that in the back of the throat is to use a scope to confirm the diagnosis. From there, we talk about, typically with both Tracy and I in the room together, so it's a multidisciplinary clinic, about what the problem is. We show pictures of it, just like I've shown tonight, so it's easy for people to understand. And then we individualize those treatment decisions based on what that patient might want. And then after the treatment, we follow up, and sometimes we'll do another scope to document improvement and look at next steps. So what are next steps? Well, there's always a variety. For some people, they will come in and we'll be able to say, you have presbyphonia. And they'll say, that's great. Good to see you today, doc. I don't want anything done. As long as there's nothing dangerous, I'm out of here. And we're fine with that. We're here to help make sure that that person's comfortable with what's going on and that they can be involved in the treatment decisions. But for some, they say, I need to make this better. And then we think about several different layers. Now, since you're coming to see an ENT surgeon, many think, oh my goodness, I'm going to have surgery, or I'm going to have a procedure. Well, that's not the case. If you look at this pyramid, we really start with this bottom area, which is called voice therapy. That's our go-to. That's what more than 50 or 60% of our patients will do first, leaving a very small portion that end up actually having to go on to have intervention. Tracy's very good. She's very talented. And so I'm going to ask her to talk a little bit about voice therapy.
Yes, great. So happy to do it. So I'm going to talk to you about voice therapy and kind of go through some typical therapy sessions and what that involves. Some of you might be asking, well, come on, does voice therapy really work? Well, there's studies out there, just over 13 that I pulled up in just a brief amount of time, that did demonstrate that voice therapy significantly improves voice-related quality of life. Well, what does that mean? Well, people came back and said that it improved their overall sound of their voice while reducing how hard they had to work to get that voice out. So when you think about it, that's amazing outcomes. That's something that a lot of people are looking for. Also, which was encouraging, is that studies show that the number of sessions average just 3 to 4 with positive outcomes. So I think some of us think about, well, what is speech therapy going to involve? How big of a commitment is this? And we're really just talking about a small number of visits with some possible maintenance program. Next slide, please. While we're pulling up that next slide, oh, here we go. Question is, well, how does voice therapy work? And I know Dr. Maronian mentioned that the sound of our voice is dependent on other systems in our body. So what are those systems? Well, we talked about the respiratory system as being the breath support, and really that's the power for those vocal cords to work. Next is the phonatory system. Well, what does that mean? That's vocal cord movement. So that's the opening and the closing of the vocal cords. Phonatory system is once you make that sound to your voice and it travels up to the frontal part of your face, what's the tone? So how much air do you let out your mouth or your nose to give you that beautiful quality? And of course, the articulatory system, which is how we form our words. And the therapy addresses all of those. So we know that being healthy can also keep our vocal cords and our voice sounding healthy. And the philosophy behind voice therapy is really based on exercise science, same as what maybe you're working on at the gym with a trainer. It's really no different. These are muscles that need to be strengthened at times, and that same exercise science is put to voice therapy. So we work on really strengthening the vocal mechanism. But optimal therapy does need to target resistance. So think about weights, and that's where that resistance comes in, and also endurance, and that refers to repetition. So what may therapy work on? Well, there's lots of different therapy programs out there that can work on presbyphonia. And I think the foundation is really taking into account all those subsystems and what's going to work best for you as an individual. So when you go to a speech therapist, you want to see a speech therapist who is really dedicated to the voice and has some specialized training to help determine through diagnostic therapy which therapy program is going to help you the most. So there's an exuberant style therapy, and there's also what we call forward focus or resonant voice therapy. And those are just different approaches to get the system working together. So with an exuberant style therapy, we're focusing on improving coordination between the respiration and phonation, but it's so important that that's based on high intensity voice strengthening exercises that will increase the endurance as well as increase vocal loudness. So those are exercises where therapists may ask you to hold out a vowel. And you're going to hold it out with this high, exuberant voice using lots of energy. And then you're going to use that same energy to glide the voice up and down, which really works on exercising the vocal folds and lengthening them and contracting them. Then we're also going to work on trying to put that all together with words and phrases, focusing on that high exuberant style, which gets your breath support to work with those vocal cords, which gets you to open up your mouth and articulate those sounds. So it's so important they all work together. For some people, that can be hard to put together, even with the most experienced therapist. And then we back up a little bit and do what's called forward focus therapy, which helps people just to find those places in their body to be able to do a more exuberant style of therapy. The typical therapy program really is about 4 weeks, so maybe 4 visits. But following that, it's so important to establish a maintenance program. Like any muscle in your body that you've exercised, if you stop exercising, those muscles will weaken again. So we need to talk about, well, how are you going to maintain this great voice you've come about and keep it where you want it to be at? So we talk about a maintenance program. And sometimes those maintenance programs involve respiratory muscle trainers, such as the EMST 150 or the breather. I'm going to talk a little bit more about those respiratory muscle trainers. My experience is they've been very important for patients in this maintenance program phase. Okay, so the power of the voice, as we said, comes from the respiratory mechanism. And we know that aging adults often experience a reduction in the respiratory mechanism. This reduction can include mass, strength, and compliance, which impairs the ability to generate enough force for activities like speech, song, cough, swallowing. So you can imagine how all of those are really important. And I'm going to show you, this is called the breather. And this is one of those respiratory muscle trainers. It has 2 dials, one on each side, and those dials increase or decrease resistance. What I like about the breather is it works on both inhalation and exhalation. And what's also really nice about it is you have a tool. If I say to you, all right, you're going to do your voice exercises that you have done so great at for the last 4 weeks, let's back off from doing them every day to doing them maybe once or 3 times a week, but I want you to add in the breather. And you're going to practice that breather twice a day, and you're going to do 2 sets of 10. It kind of sounds something like this. And that counts as 1. There's also another respiratory muscle trainer that we often issue to patients, and it's called the EMST 150, and it's a little bit different. The resistance is increased or decreased by this dial on the side, and you're working on one strong exhalation. And it kind of reminds me of that exuberant style of voice therapy. And patients do really well with this. I'm going to demonstrate for you. It's just a very quick, hard blow, like that. And this one is done 5 sets of 5, just once a day. So exercise science teaches us that muscle deconditioning occurs faster than it takes to condition the muscles, which is why this maintenance program is so important. And I know that's hard to hear, but it's really just the truth. But I think that it's so important to keep functioning the way we want to, especially when we're thinking about staying within this workforce. So I want to tell you about a patient of mine, and I have lots of patients I work with presbyophonia. This one's sticking out probably because he's my most recent graduate. So he's 72-year-old male. Maybe he wishes he was still 17, but 72-year-old male, and he is still working. And his work involves still presenting at board meetings, which have now been a lot on Zoom. And he has found in that environment that it was really difficult for him to present himself the way he was used to presenting himself because his voice sounded a little raspy. And he thought that people weren't taking him as seriously with all of his amazing ideas. He saw Dr. Maroney and I in the Voice Center. We did a complete examination, and it was showed that everything looked great, everything was working, but he did have a little bit of that gap in the vocal cords. And in order for him to close that gap, he was pushing so hard, and that's where that raspiness came from, and also his fatigue. So I worked with him, and we started the therapy. And during that first visit, I really try out a lot of different therapy styles to see what's going to be the best fit. We went with the exuberant style, and I followed him once a week for those 4 weeks. And every week he was saying, you know, my voice is sounding better, and I feel like I'm not even working as hard. And I think that was, you know, that's really the key, right? At the end of those 4 weeks, he just talked about how he's going to his meetings. Less people are asking him to repeat himself. He feels so much more confident. At that point, I did encourage him to continue to practice 3 times a week. And then I also issued him a muscle trainer, which he said that was perfect for him, something he could just pick up, do it twice a day, and not an issue. And he was so happy with the outcome that he said that he was completely motivated to keep working. I also encouraged him to call me back. You know, sometimes we need a little refresher course, just like any muscle building program. If we fall off a little bit, hey, a refresher is no problem. So in general, besides continuing those voice exercises and the respiratory muscle trainer, we talk about good vocal hygiene, and that's important for all of us. Moisture, so drinking 6 to 8 cups of water per day. If those tissues get dry, our voice is not as smooth, and also we tend to start clearing our throat, which then can lead to irritation and vocal cord swelling. So we really want to avoid that drying effect by drinking more water, trying to reduce caffeine and alcohol. We talk about medication effects. Sometimes there's not a lot we can do about that, but maybe we can add in some dry mouth lozenges. That's a quick and easy fix there. So again, avoiding throat clearing and cough. My best suggestion is just to swallow instead. Great opportunity to take a little sip of liquid, since you need that good hydration anyway. And using it wisely. So with that maintenance program, you know, it's not just about doing the exercises and doing your muscle trainer and drinking lots of water. You really need to use your voice and enjoy using it. When we talk with a lot of expression and we get and we're feeling energetic, then we actually do get a better breath support, and we bring that voice out, and we use all those great techniques. And sometimes that can be a little bit fatiguing, so you want to listen to your body and maybe take a little break, whether it's 20 minutes, an hour, 2 hours, and then get back into that good voicing. So using it and being social, well, it doesn't have to just be the sentences a speech therapist gives you. It can be storytelling. It can be talking aloud to yourself. It can be talking to your pets, talking to your neighbors. We love singing and humming, and that's another way to keep things strong and as part of a maintenance program. If you enjoy that over the exercises, after you've completed a good therapy program, we figure out a way for you to work that into your home program.
All right, well, thank you, Tracy. That's a lot of good information there. And I think, as we've said, for most of this, we wanted to be very reassuring that these changes are relatively normal and they're things that we can treat. There are times, though, that we think about what are the danger signs? What are things that I really should be concerned about? Well, one of them is if you have hoarseness and you're having swallowing problems. Talk about aspiration, and that's really a choking that happens when we're eating. Sometimes it can happen just on our own spit, on our own saliva, but most of the time it's associated with eating. And so if we're having the hoarseness and the swallowing issues together, that requires an evaluation. If we have a weak cough, so instead of that nice, strong cough, it's very weak, it's hard to bring our secretions up, that's important for a look. And if it's sudden, it's even more important that be looked at quickly. We've talked a lot about the breath. And so if we're having difficulty with just maintaining that breath, with breathing of any sort, that requires an evaluation sooner versus later. So what does the office evaluation look like? We've talked about the visit, we've talked about the history and the exam, all pretty standard. The scope can be very intimidating to some people. And it's when we take a very fine little telescope and we put it through the nose to look down at the vocal cords. It has a camera so that we can see it on the screen, can record it, we can show the images to the patient and to the family. What I want to assure you is that this exam is very short. I think it's pretty easy. We do a lot of these, and for most people, they say, man, I was so worried about this. I didn't realize that it was going to be pretty straightforward. We do put numbing in the nose. Most of the time, some people don't want any, but most of the time we put some numbing in the nose and the throat. So for people that have a really strong gag, it tends to allow us to do this exam with comfort. It gives us a tremendous amount of information, not only to just diagnose, but also when we review it together with Tracy, if we're deciding about therapy, she knows what things work. So sometimes she'll try a couple things out while we're there in the exam room to know exactly what direction to go in therapy. And we have a lot of office-based procedures that we can do. So if we move past therapy, which again, that's our go-to, that is very successful in so many people. We're very fortunate with that. But for some, we do need to move on to procedures. And the procedures we think about are things we can do, again, in a minimally invasive manner. So we think about office-based procedures, and one is a vocal cord injection. This is a picture of before. Remember that little bowing that we saw? And this is a picture of after, when we really fill in that vocal cord and make it quite full, so that then you could imagine when those vocal cords are coming together, that space is closed again. We use different kinds of injectables. Some are the same that we would use for wrinkle filler in our face, and they're made from natural substances that are in the body already. They're completely absorbable, and they tend to be exceedingly well tolerated. So we do these in the office, again, with a type of a scope, and people are awake, they're alert, and they're able to go home. They don't need a ride in. And the only thing that we ask is that they have a very quiet next day so that they're able to have some voice rest for about 24 to 48 hours. And then the injection lasts sometimes for long term, sometimes for a shorter period of time. And then we can decide whether or not we need to do any other procedures. There are surgeries available. I don't think that's the most common thing when we're talking about presbyophonia, but I did want people to know that there are specific surgeries where we might put a little shim in next to the vocal cord to also help push it over to close that voice box. So as we think about things and try to pull this all together, our thoughts today, we feel your voice is very important. Be aware of how you're using it. Talking again about that move it or lose it, and trying to use the voice with good technique. And if it doesn't sound right, if it's bothering you, if you've been hoarse over 2 weeks, you should see either your primary care doctor or consider an ear, nose, and throat physician. And with that, we will end, and we both thank you very much and would welcome any questions.
Thank you, Dr. Maroney and Tracy. We do have some questions that are filling in, so we'll get to those. And if anyone else would like to ask a question, you can do so by typing it in the Q&A button at the bottom of your screen. Our first question tonight is, I have used Advair and Brio inhalers for asthma prevention, but both of them make me hoarse. Most recently, I've used Brio. I use it daily as directed. The hoarseness gets so bad that I almost lose my voice. When I don't use it at all, I get a wheezing on exhalation. Is there anything I can use for prevention that won't affect my voice this way?
So I'll answer that one, Tracy. That's a great question. And it's something that we see not infrequently in the voice center. So one of the things that can happen with steroids is that the inhaler lays on top of those vocal cords. It actually can coat the whole area of the throat and then slowly goes down into the lungs to do what it's supposed to do, which is make your breathing easier. The challenge is we have to also rinse that material off after it's gotten into the lungs. So we often talk about the importance of gargling after using inhalers. And what we counsel you to do is to gargle 3 times. So the first time, gargle and swish things around in your mouth, just some regular tap water, and do it for as long as you can. If you can do it for 2 to 3 minutes, that's great, then spit it out. Second time, gargle, slightly shorter period of time, but then, swish it around your mouth and then gargle as long as you can and spit it out. The third time, do all 3 together, swish, gargle, swallow. And that tends to wash away any residual effects of the inhalers so that they can work where they're supposed to work, which is in your lungs, and not affect the vocal cords in the throat. If the hoarseness remains persistent, like what you're describing, you probably need to be seen to make sure that there is no infection evident, because sometimes we can get yeast infections from the inhaler usage.
Thank you. Our next question tonight is, I suffer from vocal fatigue, especially after talking on the telephone. I've been told by an ENT that I have either a paralyzed muscle or nerve from probably a long ago viral illness. Is there any treatment for this?
Tracy, do you want to answer that?
Sure. Yeah, I think the first step is when we take a look and then we're able to actually try some of the voice techniques to see if you're able to get good closure by increasing the breath support or working on some strategies like that. We often would start with some therapy to see if sort of changing the way that you're compensating for that little bit of weakness. If you do well with that, then you're done. Otherwise, there are other options just to help support that weaker vocal cord.
Yeah, and I think that's where the exam is really important. And so when we're able to do the scope and put it on the screen and look at it together, Tracy and I often will talk with the patients and the family and say, this is what we see. If it's 1 vocal cord, if it's 2 vocal cords, and then talk through what are the pros and cons of therapy, what are the pros and cons of an injection, which is absolutely indicated if there is a known weakness, and what are the pros and cons of having surgery. But it's all dependent on what the diagnosis is, and being able to share together and look at the images and talk through those options, I think would be very helpful if you're considering treatment for that disorder.
Thank you. Our next question is, the person would like you to speak to the relationship to tone and sound of the voice related to hearing loss.
Tracy, that's you.
Yeah, well, yeah, I mean, it does get complicated because we do use our ears to fine tune our voice. And so when there's even a slight disconnect there, it can be sometimes difficult to achieve the sounds that we're working on in therapy. I try to really work with people on using different senses within their body. So maybe the ears are having a hard time fine tuning it, but how does that feel? Do you feel vibration up here? Do you feel your diaphragm kicking in? So we try to use whatever senses we have that could help get that sound. Once I hear that sound, then I'll check to see if you hear that sound and if you can achieve that. So it does play a big role, but it's not, it doesn't mean that therapy is out of question. It certainly can also still work.
And Tracy, when we talk about hearing effects on the voice, one of the things that we talk about is that we want to make sure that we've also optimized the hearing. So sometimes, Tracy's office is right with the audiology offices. So sometimes we'll also just update the audiogram to make sure that there haven't been any changes, because those two things do go together. So if the hearing is worsening, it's not unusual to also note that the voice might be worsening.
Great. We have a couple singers in the audience tonight, and so some of the questions that are related to this are: how can we prevent issues happening, especially for the singing voice? That's where people seem to be noticing the most change. Are there exercises they can do? And is there anything they can do to keep their voice healthy, or do they need to wait till a problem begins and then come see you?
I would say yes, yes, yes. There's lots of things that you can do.
All of the above.
Yes, and we absolutely would rather see a patient proactively to look at options to stay well than to wait until it becomes a big problem. Because I suspect if someone's noticing those types of issues now already, that there's probably something that they're starting to do to accommodate. And remember, we talked about that accommodation sometimes is using other muscles to squeeze harder to kind of get through, because you think, I think I can make it through this choir practice if I just push more, if I just get louder. And then we do it once, we do it twice, we do it for several months, and then all of a sudden we just had it and we can't do it anymore. So we'd rather start on the front end when it's more of a mild annoyance versus waiting for it to become a bigger issue. So
sometimes people come in and that comes out a little bit later. Well, my singing voice has really sort of been challenging. And I do think that working on where the voice is coming from, like maybe just subtly you've developed some of this muscle tension and just unaware, like it wasn't just overnight. And so, but we can see that on the scope. And then there's certainly exercises that can help undo that to get the voice back. And I think, even addressing that and doing sort of having somebody check on your singing style periodically is probably a valuable tool to make sure you haven't even slowly incorporated some of that muscle tension.
And I think from the singers, I would say that singers are incredible partners for us when we think about diagnostically looking at the vocal cords and when we think about therapy, because they're very knowledgeable about their voice, how it feels, what they can do, and they're the athletes of the voice, really. And so sometimes it's making just some small tweaks. Sometimes it's thinking about breath support. Sometimes it's thinking about adjusting range or style or adding some amplification. So there's some very practical things that can happen. We always start with speech therapy because it's focused on those basics, but sometimes we also transition into singing therapy so that we can pay particular attention if it's really just the singing voice that's affected.
Thank you. Our next question tonight is, can the use of a CPAP machine for sleep apnea cause issues with the vocal cords and the throat in general?
Yeah, Tracy, I think that goes to some of the issues around the moisture and the dryness, right?
Right, absolutely. And I think even like the CPAP machines that have the humidification, there's still a drying effect. So some good vocal wellness, waking up, doing a seltzer gargle, perhaps just getting out those dried secretions, using some of the dry mouth lozenges can be helpful.
Yeah, so when you have the mask on all night, the linings are different. And so some of the tips that Tracy mentioned, we find are very helpful in patients that we counsel. So taking the mask off, gargling, even if it's just with tap water from the shower, or sometimes that seltzer water is what you have found has been helpful, right, Tracy?
Right. I've gotten a lot of great feedback about the seltzer water, club soda, doing a couple gargles with that in the morning, just breaking up any dried secretions. It just flushes the larynx and you're able to spit it out, and it's quite refreshing.
That's right. And I think the thing that's important is that you want to fight that feeling of I've got to clear my throat and cough all this stuff up. I think one of the things that we know about CPAP usage and dry membranes is that it can feel like there's something in there. Most of the time though, and it's just dryness. And so start first with those conservative things, because if there's a lot of coughing and clearing and trying to get junk up, it's going to impact the vocal cords. And that's where the hoarseness is probably coming from, more so than the CPAP. So think about that vocal wellness, think about those safe strategies of the gargles, the seltzer, even some dry mouth lozenges to start the day versus trying to pull up all of those secretions.
Our next questions revolve around injections and the patient that you shared an example of. First, would like to know if that patient, if you were able to repair their vocal cord issue. And then secondly, what are some short and long-term injection timeframes, and what improvements happen after vocal cord injections?
Great question. So vocal cord injections we'll do in the office. It's about a 30-minute time frame, but the overall procedure only takes about under 5 minutes to do. There's different kinds of injectables that last for variable periods, and we choose them based on what the patient needs. So for the example that I gave, that patient chose a temporary injection that lasts about 3 months because of the issues that she was having. So the injection is a natural substance. It goes away on its own. So in the very first beginning, I always overcorrect a little bit. So it makes the voice kind of tight and strained, kind of like you have a cold. And that might last for a couple of days. And then the voice settles out to what we'd consider normal. And our patients will tell us, boy, it just feels normal again. It's easy. I don't have to think about my voice. And then for many, that's the bridge to just getting their voice back. So it sort of resets things. For others, the effect will wear off. And then we need to decide if continuing with injection, perhaps moving to a longer last, or transitioning over to a surgery is the right step. But we really are focused on individualizing our treatments. And so we spend a lot of time thinking about what's the right thing for that particular patient, because there's no easy solution that fits everybody.
Okay, we're running out of time tonight. We have time for just a couple questions. If you would like to still type your questions into the Q&A, if you leave your name, we will see that they're answered after the talk tonight. Just following up on a couple remaining ones. First, people would like to know where you're located.
Oh, great. Well, Tracy and I work together in locations. We are in clinics, Chagrin Highlands, just off of 271, right across. We are also located at the Cleveland Medical Center, so off of Euclid Avenue. Tracy has, though, an additional location on the west side at our Westlake Health Center. And so she does therapy in 3 different locations on the east, the west, and at our main flagship hospital, Cleveland Medical Center.
Our next question is, I'm hard of hearing in both ears. Is a hearing aid needed before voice treatments start?
It's not needed. It's not required. But what I think it depends a little bit on the degree of hearing loss. I think it depends a little bit on what we find. So sometimes just going through some basic exercises can help to rebalance the voice, and Tracy can work with you to find a better way to use it. And for some patients, that's all they need is that reset. For others, it pulls out the fact that the ability to hear the voice and tune the voice is a problem. And then we need to recommend considering, audiograms and potentially hearing aids. But it's hard to say without being able to see you and knowing how severe the hearing loss is, things like that.
Right.
Anything else, Tracy?
Yeah, I mean, I think I would agree. So it depends on the severity of the hearing loss. And I think a trial period of voice therapy is totally reasonable. Going into it knowing that if we're not meeting those goals, then it might mean to consider hearing aids. But I think a trial therapy is totally reasonable. I would be careful not to go to a therapist that says, yes, I can fix this, and they sign you up for 12 visits. I think I would be really careful about that. And it takes a therapist who is skilled in this area that can identify when, I think we've sort of reached your plateau here. Let's add in these other tools, tips, hearing aids, whatever it may be, and then we can do some more. So but certainly a trial is reasonable.
Yeah, and I think we really try very hard to keep our therapy sessions so that they're manageable. So we know people work, we can do virtual therapy, we can do live therapy. We typically combine those together. And we try to keep it between 1 and 4 visits, maybe once every week or every other week, because we want it to be manageable and we want you to practice a little bit of what you're learning as you apply it to either work or social situations. So we try to keep it in a reasonable time frame so that it doesn't feel like it's an investment every day or for long periods of time. But everyone's had such great questions today. It's been really fun to talk about this topic, and we really thank you for your interest in the terrific questions. So thanks, everybody. Have a great evening.
Yeah, thank you.
Thank you again,
Bye-bye.
Dr. Maronian and Tracy, and everyone for attending. And as a reminder, you will be receiving an email with a link to go watch this video in approximately 1 week. Thank you. Have a good night.
Thank you. Bye-bye.
Thank you. Bye-bye.